Just to thank the organisers for the invitation to give this talk. And as the title says, I'm going to describe the secret life of a core facilities manager. And I'm going to go through a number of points. Some of you may not really know what core facilities are, so I'll go into that slightly. Talk about how I got to be a core manager. Facility or a core, I'm using those two terms interchangeably, really. What skills are required to be the manager of a facility, what you kind of want to have from before and what you will gain as you do it, some of the challenges you encounter at being a core manager, and then the opportunities that arise within the role. So what is a core facility and why do they exist? Well, it's given here as a facility that offers state-of-the-art instrumentation combined with a high level of expertise for operation and scientific application. And there was a publication in 2009 which actually raises the fact that there are a lot of core facilities now in academia, and there's a lot of things to be considered to make sure this core facility works well within the facility and what it can contribute to both the institute that you're situated in and also to the researchers and to the wider network. And I'm coming from a mass spectrometry core, but there are a number of different types of cores, and there's a list here including mass spectrometry, of course, but you can see a lot of different facilities that you may have encountered are actually these core facilities. So you've got flow cytometry and pharmacology and transgenic mice. So all of these are facilities, and all of these have some sort of management that's behind them, but all of them have somebody or a group of people, a team of people who have great scientific expertise behind them. So my career, and how did I get to be in this position of being a core manager? I did a BSc honours in chemistry, completed in 1998, and then I went on and did a PhD in analytical chemistry. Then I took up a junior postdoctoral position in the mass spectrometry core at the University of Edinburgh, which was part of the clinical research facility here in Edinburgh. In 2006, then I became the mass spectrometry core manager. And just taking a look at this year alone, in 2015, still as the core manager, I'm organising a networking conference. I'm involved in procurement. I'm able to attend conferences. I supervise a PhD student, and I supervise a number of student projects along the way. Science, as you can imagine, from my BSc all the way up to now, is continuing to increase my knowledge of science. I've not stagnated there. I certainly don't feel like I have. Management has risen, as in the amount of management I do from 2006, really, when I was the core manager, until now. And this is really accompanied by the fact that the core has expanded. We used to have one mass spectrometer. We now have 4 or 5 different mass spectrometers and different types of instrumentation, and with that is a complexity of management. And as I've just noted there, I really wanted to point out that you have this management, the scientific contribution that you have, the student supervision. You can become a member of committees, as Andrew was referring to there, and getting involved in your recognised support network. And all of these points are recognised in the university career progression. So really what I want to put across is the fact that being a core manager doesn't mean that you're just doing one job. You can guide it in a direction that actually suits you and suits your strengths. So what do we need? What do we need to manage a core facility? You need an expertise in your scientific technology and your specific technology. Part of my PhD with 3 major technologies, and mass spectrometry was one of them, and that's really why I've gone into this direction. You have to be able to interpret the data and, of course, report the results, and paper writing is important. I do write papers, methodology papers, and obviously contribute to the method section within larger papers. Along the way, I've gained a number of skills: project management, financial management, resource management, and procurement, and personnel management. And those are all things that I never really looked at during my PhD, never even thought that it was something I would want to pursue. And I think another thing is, if you actually get to become a manager within a core or work within a core, you'll gain those skills. You'll certainly pick those up, and they're translatable into other sectors outside of research. Just going back to what a researcher expects from a core, and actually perhaps those who have used cores haven't really thought about what goes on behind the scenes. They'll come up to us and say, please, can you analyse this sample? And can you do the lab work? And when can I get the data? And sometimes we're approached mid-project in response to reviews or with unexpected findings, and they need to have an answer, and can we look into it for them? Really what I wanted to raise here is that mid-project queries usually mean limited funds, but of course we don't want to turn people away, so we're trying to work around with limited funds and actually help to answer these questions. And one of the major things that I've certainly recognised as the years have gone by is what we're faced with is a research question from somebody, and then we have to convert that into an analytical question, I suppose. I've written an answer there, but ultimately it's an analytical answer. So first off, we have this meeting with somebody, then we'll try to understand that research question, and then we'll answer the research question that has been asked. Can we do that? Can we do that within our lab? And is it feasible? We have to work out whether it's feasible in terms of time. Can we do it in the time constraints that they may have? Can we do it with the staff that we have at the moment? Which resources would we use? And how much will it cost? And some of the examples, I've just taken a snapshot really over the past couple of years, and we've been approached to do a number of different studies, all of which have gone forward to some extent or completed, looking at paracetamol toxicology, Ethiopian cows, zebrafish, panda, mini pig cells. There's all sorts of different things that we encounter along the way. And of course, there's a huge diversity to that, and we need to understand as much as we can about the system before we can then go forward and say we can do the analysis. We need to know what sample size they're prepared to provide, if they have enough. And at that point, we might say you don't have enough. It's not going to be a sensitive enough technique for this analysis. We have to be aware of the sample stability and what type of sample will it be. Sometimes people will provide whole blood, sometimes people will provide plasma. Will it be frozen? And all these considerations, we have to be aware of every single thing, because what we don't want to do is do analysis and realise that something at the very beginning of the project could have been amended. So we also have, and it's important to do this, is to build up a network and understand other core facilities and what they could do. If we're approached, we like to be able to at least pass it on to somebody who could help them if we're not able to. So really the networking and the expertise and understanding of the expertise within your local area, but also nationally, is really important. So really what we do is convert this research question into an analytical answer. There's a kind of flowchart that we follow through when we take every research question. We may have to refer it to within our network to pass it on to somebody who's more able to, with their expertise, to do that particular area. Otherwise, we'll convert it into an analytical question that we'll then try to apply. We could use an existing and validated method and report the data. And this is a very simple approach. We've got discrete project costs. We'll understand how much it's going to cost for us to do, and we'll actually give a very good idea of timescales. What does happen sometimes is that we'll be approached and we'll have to develop a new method in order to do this, and then we'll need to develop this method and then report the data. However, this kind of thing leads to different outcomes. We have no idea how long this is going to take and how much it will cost. And this is really limited by the staff time and expectation management of the person who's come to us with that research question. Staff time, as in how many people we have in our core facility as it stands. Some of this is controlled by what already exists, and it's also to do with how much has been put into the core beforehand. So if we've developed, as I said, that we have expanded, then we've got more members of staff and we've got a greater capacity to deal with more projects. So what the core users see is the samples are given to us for analysis and then data is reported. But really behind the scenes, we have not just a way of doing it. We try to work to industry standard, and we tend to follow good clinical practice. That's a whole new approach to science that I hadn't had to do whilst I was doing my PhD. So we have to log the samples, we have to store the samples. Sometimes labs might have LIMS, which is electronic management of samples. We have to process the samples and prepare them to SOPs. And we have to use a validated assay, and the publications that we go forward to publish are following the FDA guidelines. The Food and Drug Administration of America set out guidelines by which we validate our assays. So anyone coming to us to use our facility is actually getting data that's actually been validated correctly. And of course, we then hope to provide robust and reliable data, which is double-checked by our staff and then by the processes that we have set up within the lab. So we've got quality control and accountability that we're actually offering. We also provide data storage and data backup, which is important. As I mentioned, we're following good clinical practice standards. And we also a huge part of our work is maintenance of the equipment, making sure it's under warranty, making sure it's serviced, making sure that what we're doing and providing is actually trustable data. Here I wanted to give an illustration of really a case study, actually, an approach from Professor Mandy McLean in Glasgow, and she had said, could we look at estrogen metabolite analysis? So she has an interest in pulmonary arterial hypertension, and there is a higher instance of that disease developing in women, and so proposed that estrogens are having some contribution to that disease pathology. And this wasn't a simple question. Estrogens actually in a mass spectrometry, you will know that it's hard to ionize these things, and so we've had to try to improve the way the assay is done. And in order to do that, can't do that whilst I'm doing all of the management of the lab, and we've got 2 core staff who are doing all of the other assays that are happening, so we're just trying to fit that in along the way. So in order to advance the assay, we've hosted 2 PhD students within the lab, supervised 2 MSc students to advance the assay as well, and this data was then presented at Barcelona last year. And then going on from that, we managed to get a grant from the BMSS, which is the British Mass Spectrometry Society, to fund further innovation, and we managed to generate enough data which then went forward to the BHF, and we managed to get a BBSRC iCase award with GSK, and that's £500,000 to advance this, and we're really in a position now to go forward with that. So if you think back to the process I had last time, the flow, we've got this new research question, analytical question. You can see the timeline. It's taking us 2 years to lead to a state where we are able to report data and take biological samples, which really relies upon the investigator being patient and understanding that we are able to provide this as long as they are willing to invest some time, if that's what they'd like to do. Just to summarise that there again. We also did a network referral within that. We passed that along to the Scottish Metabolomics facility over at Strathclyde University so that they could do a different type of mass spectrometry for their analysis there. So honing back in on the management skills, because of course that's discussed the science that I have done and continued to learn. We have finance. So we actually worked for a cost recovery model. So that's something new. I've had to learn how to bill for assays and projects and get an idea of how things can be billed, and also understand the university's financial arrangements and how you bill, how you check your budgets. Annual report, we have to report annually to the clinical research facility that we're administered by, have to understand and raise costings for grants for people approaching us. Procurement, as I mentioned, has become a big part this year. A grant has been raised, and we're open to procure a new mass spectrometer. We need to know what new technologies are out there and to future-proof. So you're not just stagnating. I think really I'm just trying to reinforce that. You're actually really continuing to advance with the science. And from a personnel perspective, core staff, so there's career progression that you have to consider within your core staff, and you're also needing to do appraisals. There's a number of different levels of students that you have. Clinical students, you have undergraduates and postgraduates and vacation studentships too. So there's lots of different people that you interact with on a daily basis. And of course, project management, you want to be responsible and provide the data in a timely manner. We have to work out the feasibilities, whether it's actually something we can really do in terms of time and resources, and prioritize those projects, and also report the data in a timely manner. Challenges, of course, there's challenges. So project management is a tricky one. And resource management, working out which of the mass spectrometers can be used in my situation, and making sure we use them overnight and weekends if that's what's necessary. But we know we can't please everybody, and that can be trouble. It can be a shame. There's instrument downtime and time pressures too, so the time pressures coming from those projects that need to be done in a certain time. You have to weigh up what's going to be the best use of time. And really recognising and accepting limitations of the core, and then seeking alternative facilities if that's necessary, passing this project on. And science can't always be the main focus. All of the project management that I was talking about there, I can't just always go back into the lab, and it has to fall to others in the lab to push things along sometimes. But what do I enjoy about this role? This role really has given me a level of job security that I don't think I would have got from having gone through aiming towards a PI. I've been able to stay in the Edinburgh area, which has been useful for me because I have children and a family. And but in addition to that, been able to focus on scientific technologies, challenges that I didn't know that I'd be able to do. And I'm able to pursue my academic research. That is still something I can do. I'm also working with a number of people, and I have really networked to get and understand what the institute that I work in needs and how mass spectrometry can help. So I'm contributing to a number of different research teams, able to write papers and grants, present at conferences, how I am drinking with Ruth, to develop financial management skills and improving resource management skills, and always looking to see different ways of managing. And I think I didn't realise how much management there would be involved in this when I first started. There's opportunities to work with industry there. I mentioned that GSK are funding part of the work to continue for estrogen metabolites. And new opportunities are arising all the time. And I think seeking new things that are out there. We're setting up a Scottish Metabolomics networking meeting just at the end of this month. And I'm involved in communications committees. And of course, you can always get involved in scientific committees that you may be interested in if you take this route. So where do I fit in within a research environment? I'm obviously not a PI, but I am actually, I would like to think, some part of the jigsaw puzzle. And people can approach us, and then we can send people off in different areas. And it's just quite, it's just a nice situation to be in, because you have a level of expertise, and it's very focused, but you're able to help people. And being able to help people is actually really quite rewarding. And that's some of the team. So thanks for your attention.
Now, I realise we're running a little bit late, but if we could have a quick 5-minute panel meeting if people want to stay, and if anyone's got any questions, they can come up and ask. So if I'll invite the speakers, thank you very much, back onto the floor. Anyone? One thing, Susan, I was interested, you were talking about how the science students, they valued the analytical skills that came through that route. I may be curious about art students. What are the things that art students are valued for that science students perhaps are lacking?
It depends on the role, and it depends on the sector, but in terms of that, maybe being able to argument, see different perspectives. Sometimes within science it's a bit more, there's a right way and there's things that don't work, whereas maybe within arts and humanities it's much more grey. So that's maybe one. But yeah, much would depend on the role.
Just for Andrew, can you talk a little bit more about the requirements of getting a lectureship versus getting a fellowship? Because obviously they are kind of slightly two different tracks, although you do both.
Gosh, it's very loud, isn't it? What do you think about that? I guess it's, for me, I kind of, as I said, I was sort of the opinion that I kind of wanted to keep a hand into the bench science still, but I knew perhaps that's not where I wanted to be longer term, and I kind of wanted to move more into a research management role. And I did kind of, I was quite keen to go down the teaching route as well. It's something I've always wanted to do. And so I think those two combined kind of made the choice for me. I think if you're interested in driving forward the research, of immersing yourself fully in the research, and you've got the ideas and the strength of the publications to back it up, then maybe the fellowship route is for you. I mean, I don't think there's a reason to pick one or the other. I think you can potentially, if you're good enough at planning and think about it, hedge your bets and put the fellowship application in and explore the other options as that one's panning out.